Hi, welcome to Pathology Riddles. Today we will be dealing with the topic of syphilis and its cardiovascular complications. Syphilis is basically a chronic venereal infection caused by a spirochete, Treponema pallidum. The host for Treponema pallidum is human. The source of infection are mucosal or cutaneous lesions. When a sexual partner is in contact with these lesions in early stages of syphilis, the organism disseminates through blood and lymphatics after entry into the new host. So, coming to the stages of syphilis, stages are basically primary, secondary, and tertiary syphilis. Primary syphilis, it occurs approximately 21 days or a few weeks after the infection. A lesion called chancre appears at the point of entry, and systemic dissemination of the organism occurs. So primary syphilis, the host immune response tries to contain the infection. So there will be non-treponemal antibodies which cross-react with host molecules, and there will be treponemal antibodies which are antibodies against these treponemal antigens. If the organism is not eradicated by immune responses, it will progress to secondary syphilis in 25% of the cases. So secondary syphilis, if the primary syphilis does not spontaneously resolve in 4 to 6 weeks, or if there is no antibiotic treatment, so 25% of these untreated cases will progress to secondary syphilis. The lesions in these cases are very infectious. They can also resolve without antibiotics. This is the early latent phase of syphilis. So if the secondary syphilis is not treated or does not spontaneously resolve, then it will progress to tertiary syphilis. This phase occurs after 1 year of initial infection. In 1/3 of the cases, new symptomatic lesions will develop after 5 to 20 years. So tertiary syphilis, the lesions will occur in central nervous system, cardiovascular system, and less frequently in other organs also. So the primary lesion is called chancre. Secondary lesion will have palmar rash, lymphadenopathy, and condyloma latum. Tertiary lesion will have neurosyphilis, aortitis, which includes aneurysm and aortic regurgitation, and gumma. Coming to congenital syphilis, in cases of congenital syphilis, the transmission is across the placenta, that is from mother to child. In primary and secondary stages, there is maximum chances of transmission. The stigmata of congenital syphilis develops after the 4th month of gestation. Without treatment, around 40% of in utero death is there. So congenital syphilis can cause late abortion, stillbirth. In infants, it can cause rash, osteochondritis, periostitis, and liver and lung fibrosis. In childhood, it can cause interstitial keratitis, Hutchinson's teeth, and eighth nerve deafness. So coming to cardiovascular manifestations of syphilis. So in syphilis, the pathognomic microscopic lesions are proliferative endarteritis with plasma cell rich inflammatory infiltrate. So basically, the inner lining of the vessel wall will be having inflammation, and it will be having this plasma cell rich inflammatory infiltrate. Now, endarteritis is due to endothelial cell activation and proliferation. It leads to perivascular fibrosis and luminal narrowing. As with any inflammatory lesion, there will be swelling. So it will lead to luminal narrowing, and as the inflammation progresses, there will be fibrosis. Periarteritis is also seen. Syphilitic aortitis is seen in ascending aorta and aortic arch. It occurs in around 80% of tertiary syphilis cases. In syphilitic aortitis, the part of aorta which is affected is dilated and it is adherent to the surrounding mediastinal structures. When the vessel is opened longitudinally, the intimal surface is having this pearly white thickenings and the cut surface is firm and fibrous. These thickenings might be from a few millimeters to a centimeter in diameter, and the lesions are separated by a wrinkled normal intima which looks like a tree bark. Endarthritis and periarthritis of vasa vasorum in media and adventitia. So the inner and the outer lining of the vasa vasorum, which is supplying the cardiac muscle, is affected. There is perivascular accumulation of plasma cells, lymphocytes, macrophages, that is all the chronic inflammatory infiltrate, to form miliary gummas, which will further undergo necrosis and will subsequently be replaced by scar tissue. There will be intimal thickening due to dense avascular collagen and it will undergo hyalinization and calcification. So the complications of syphilitic aortitis will be aortic aneurysm due to weakening of the uh, vessel wall. Then there will be aortic valvular incompetence. So as the vessel wall weakens and it progresses towards the ascending aorta and aortic valve, so valvular incompetence will happen. It used to be a very important cause of aortic valvular incompetence, but now the more important cause is rheumatic heart disease. Then there will be stenosis of coronary ostia. So coronary ostia, if it is stenosed, then the coronary arteries cannot get enough blood. So there will be myocardial fibrosis, angina pectoris, and sudden death can also happen. So diagnosis is by serology. There will be non-treponemal antibody test, which will be positive after 4 to 6 weeks post-infection, but it will become negative when the syphilis enters into the tertiary stage. Then there will be anti-treponemal antibody test. Again, it will be positive 4 to 6 weeks post-infection, and it remains positive even in tertiary stage. It is basically a screening test. And non-treponemal antibody tests are confirmatory tests. So treatment is very simple: penicillin, short course. It is effective in all stages of the disease. So this was all about syphilis and its cardiovascular complications. Uh, Please do like, share and subscribe. We will see you in the next video. Till then, this is Dr. Bismay signing out.